Thanks for staying with us. We have Dr. Wakeel here. Let me go to prevention. I think Mariam tried to ask that question. Those who don't get arthritis in their 90s, I have a grandma in my house. She's 100 years old, and she doesn't have arthritis, but her daughter has arthritis. So how is she that she doesn't have arthritis?
Well, the point is that maybe she is exposed to some factors that the woman didn't get exposed to. Yeah. You understand?
What kind of factors?
As I've said earlier, is a constellation of factors. Yeah.
Is lifestyle one?
Well, lifestyle is one. That's why we talk about the habitual positions that some people adopt, like squatting and performing religious activities for a long time, then using kitchen stool, low stool. Those are, and then if she's obese, and she didn't watch her weight, we usually cancel people because it's the load that you are putting on the joint.
How about childbearing? They say childbearing also, like if you have more children, the risk increases. I heard that somewhere. I wanted to just confirm from you.
Childbearing has nothing to do with arthritis.
Oh,
it has nothing to do with
so now let's talk about curative. How do we manage?
Now, one thing our viewers or everybody should understand is that once arthritis sets in, you can't cure it. So what we do is to slow the progression. Because we continue to age, you can't stop it. So aging is an important factor. So what we do is to slow down the progression. And how do we do that? Essentially, physiotherapy is one important factor that usually is the core of the treatment, because there is a conditions that we call sarcomere. As one is aging, so muscles around the joint get weakened. And that also predisposes one to osteoarthritis. So we try to strengthen the, especially for the knee, we try to strengthen the muscle around the knee and perform range of motion exercises. That further slows down the progression. And then we correct all the correctable factors that the individual has. Now, apart from that, we advise lifestyle modification, like shed your weight, avoid using low stool and some other thing. So once he has gotten to the end stage, you understand, at that point, it started affecting individuals' activities of daily living. Things you could do ordinarily, individual, because if you cannot move from one position to the other, then you know activities of daily living is. And for elderly individuals, we usually advise them against sedentary lifestyle. So if you can't move, then one will just be going down gradually. So at that point, all other mode of management, whether you are giving medications, whether physiotherapy, or you are giving some support to the knee, will not work adequately for the individual. So at that point, we counsel them to have a joint replaced. So there is a joint replacement surgery, which is one of the most successful surgeries in orthopedics all over the world. Yeah, people in our own environment are usually afraid of the surgery, but I can bet it's one of the most successful surgery. In our home center, Bobby, we do it every day.
So I've heard of is it the hip replacement? Or
you can do hip replacement, you can do knee replacement. Because arthritis, like I've said, there are different materials actually. There are different materials actually, but it's an alloy of steel with some special plastic in between. It's just to simulate what has been there, God has created. Yeah, because in the joint you have bone, in between bone you have some soft tissue, cartilage is there, then you have meniscus are there and some other things. Those things also get degenerated. So what is done is that we scrape the surface of the bone that is already diseased, and then we replace it with the special metal, and in between we put that special plastic in there. And if it's well done, because the surgery is meant for people that are elderly, you understand, from 65, 70 and above, it could last the life of an individual.
I have a grandma that did that recently.
And she's moving around.
Yes, she's doing very well.
So, except if it's not done by people that understand the procedure.
But does arthritis lead to osteoporosis?
Well, osteoporosis is also age-related problem. You understand? Because women generally, by the time they started getting to the menopausal period, they started losing bone strength, bone density drastically. And it's not only women, men too.
But
it's just that the women...
If we carry weight, it will help us.
Well, weight is not really... The major problem is because of the cessation of estrogen. Yeah, because hormonal changes that happens around the menopausal period.
Because I was saying that, are there some hormones or mineral that you lose over time. Like when you talk
can
about
replace.
bones, all of those people on YouTube, those Dr. YouTube and Google, they are telling us we should take calcium.
Yeah,
at a
the
young
reason
age.
why
So-
no, calcium is not at younger age. We believe that the amount of calcium that you needed, you can get them from food and everything you eat. But by the time you are getting to the menopausal period, when the estrogen has ceased, then the mobilization of the calcium from the bone loss, calcium loss from the bone is faster, is rapid. That's why we encourage at that period people should be taking calcium with vitamin D. You understand? And it's not only, so shouldn't you afraid, it's not only women. Men too suffers osteoporosis. It's just that it comes earlier in women than men. I think the difference is about 10 years.
As if
you know.
nature is against us for some reason.
They take from us. They don't want.
So how expensive is the
The
maintenance of arthritis? Because people are listening and are thinking the drugs are, how
Yeah,
expensive is it?
the drugs is actually, because these are medications you need to be having for some times. But like I said, if it's a early, the core of the treatment is physiotherapy. You understand? The medication we give in the early stage is just to calm the pain so that you can be able to have your physiotherapy section properly without much pain. You understand? But at late stage, when you have to do total knee replacement, that's where the issue is. Because total hip replacement or total knee replacement is not a cheap surgery all over the world. You understand?
Do you know if there's any research or work going on to find out different ways of maybe replacing cartilage or, helping with arthritis?
Yeah, there are many researches people have done to see whether we can replace cartilage. Is also one of the procedures we do, especially in the early phase of it, when you see that, okay, some cartilage. We've taken the cartilage and culture it and try to put it back. The other things that people do is that the chondrocytes, these are the cells that produces the cartilage, you understand? They've cultured them and see, but the results is not as encouraging as one
Just going
wants,
through the-
you understand? Because you can only do that when you have an isolated area of cartilage defect and you are replacing that. But the process of degeneration is still ongoing, it still continues. So that's why it has not worked sufficiently. But for early phase, people do it so that it can delay, slow down the progression and something like that. Yeah.
We have to wrap up with you, but I mean, I think we've learnt a few things on arthritis, and
also
my mom
happy.
had it. I know they used to have this water that comes that they have to drain out. Is there around the knee?
Yeah, it's a synovial fluid. I think one of the situations that happened with osteoarthritis is that because of the inflammation, the covering of the joint, which we call synovial membrane, tends to secrete fluid. You understand? But taking out that fluid is not the solution. Because
replacing
even
the
in
knee.
an
It's
attempt,
replacing the knee.
is replacing the knee. Even an attempt to
We should, I should have
aspirate
that
the
conversation.
joint and some other thing. You can introduce infections into the joint. And
Wow.
those joints get infected, even you may not be able to do replacement again until you're able to control
wow.
those infections.
That's
So
good to know.
that's
I
why
mean, we could have
we-
just done a knee replacement. I don't think that was ever offered as an option.
Somebody
It was
just
managed
on
and
YouTube, can BBL cause arthritis?
As
Brazilian
in
butt lift. This
those
bum
cosmetic
that
surgery.
bind
Well, the way I'm going to look at this is the amount of weight you are carrying, you understand? But I don't think fats weigh that much. You know,
We have to wrap. Thank you very much, Dr. Wakeel, for coming. Appreciate you
It's a
being
pleasure.
here.
It's a pleasure
That's
having
all
me.
we can take on today's show. Hope you learned a few things as we have. Join us tomorrow and we'll discuss the Annie Dibia story properly. See you then. Bye for now.
Tomorrow?
Maybe.
You wait for me, I'm coming on Thursday.